Good morning. I want to thank everyone for joining us today. Improving our behavioral health system, the combination of mental health and addiction services treatments has been my highest priority as a supervisor, both since being elected to the board and since becoming chair. And over the 2.5 years I've been here working in partnership with my colleagues and working in partnership with Dr. Bergmann and the behavioral health team and Nick Mascione, the agency director, we have taken significant steps forward to transform a broken, fragmented system of service society-wide that doesn't view addiction and mental health the same as it views physical health. We have invested new funds, we have established innovative collaborations, we have started new programs, we've seen significant increases in staffing, capital investments, and the entire structure around the behavioral health system. But a key component of truly investing in better outcomes for those that are suffering from mental health illness or substance use injury is a more robust effort in our correctional system. While as a board we've taken significant actions to try and divert individuals from entering the justice system, for those individuals who are going to enter the justice system, I believe we have an obligation as a board to better fund staffing and programs to be able to meet both their mental health needs and their substance use issues. Today, I'm pleased to be here with Under Sheriff Kelly Martinez of the San Diego County Sheriff's Department, with Dr. Luke Bergmann, Director of the county's Behavioral Health Services, to announce an exciting development, a new memorandum of understanding that has been established between the Sheriff's Department and the County Behavioral Health Services that is the foundation for a significant increase in clinical staffing in our correctional system. 160 individuals will be added to our correctional system to provide individuals who come into our custody with medication for addiction treatment, with mental health services, with social services, in an effort to lower recidivism. We want individuals who come into our system to not come back. And one of the most effective things we can do is try to get them on a path to wellness while they are there. And that is the investment that is being made. For the first time in San Diego County, the board is funding medication for addiction treatment clinicians who will work in our jails to help those with substance abuse issues. A significant increase in mental health clinicians to help those who come into the system with their mental health issues, and a significant increase in social workers to help those individuals upon discharge be connected to housing and ongoing services. And so the agreement that has been signed is just the start of a multi-year commitment to better build out behavioral health and mental health services in each of our 7 detention facilities. And this document is really the foundation or guidepost for the significant investment our board has made in adding clinical staff to the Sheriff's Department budget. And really, I think that the beginning of a new era of collaboration between the Sheriff's Department, our county behavioral health experts, our county workers. And I think that while it will take time to implement, I think that this is an exciting step forward and a new direction for the board to really step up and significantly fund things. With this agreement, it's a new direction, create a better, more responsive set of services for individuals in our jail, connect them to the supportive services that they need on the way out. I think this MOU is the roadmap to implement the investments that are being made in restorative health services in our detention facilities. 2 primary components of how we achieve our goals are improved service delivery and making a commitment to put more trained county staff in our jails. These are non-correctional, non-detention staff. These are clinicians in our jails. The in-custody improvements this MOU spells out includes intake and ongoing individual assessment, medication for assisted treatment, MAT, care coordination, additional identified healthcare enhancements, clinical quality oversight through quality assurance and quality improvements, coordinated healthcare record keeping, including improvement in coordination with jail information management related to behavioral health and physical healthcare services, and the sharing of data and management of that data. Again, getting our Sheriff's Department and our county behavioral health team seamlessly integrated and really working together, again, with the investment being county workers who will be in these facilities working and doing the jobs. Making an investment in our county workforce and our jails will be vital. While this agreement does not completely eliminate the use of all contracted services, there are some positions and level of expertise that are more appropriate to contracting. What it does is put an emphasis on building out a sustainable workforce model to greater ensure the continuity of services for individuals both in our correctional units and in particular when they leave. Our board, again, made a significant investment, nearly $25 million, 160 new county medical behavioral health staff. And in the years ahead, we're going to have to continue to invest in these services. We know that individuals that come into our correctional system are disproportionately impacted by substance use issues. Statistics from a recent reentry conference indicated that 70% of incarcerated folks are addicted. One full quarter of them are addicted to opioids. According to a Sandag report, 75 to 80% of people in San Diego County jails admit to taking drugs or test positive for drugs, and approximately 30% of those in our jails have had medication prescribed for a serious mental illness. This tells us we have to do something different than what we have done in the past. And this is what we are doing moving forward, a true collaboration, a true investment from this board. And we will have to monitor it over time. No doubt we will have to make adjustments. We will learn things along the way. But, you know, it's no secret that Sheriff Gore and I have not always seen eye to eye on which model of care in our jails would be most appropriate. But we got through that. And he asked Under Sheriff Martinez to take the lead. And she sat down and said, how can we better meet the need of these folks who are here? And it was really a breakthrough moment. By working collaboratively, by coming in and saying, look, I'll push for bodies and I'll push for funding and I'll push for services. I need your help for how you get the two entities aligned. And I want to commend Sheriff Gore, and I want to commend in particular Under Sheriff Martinez for her work and her willingness to say, hey, look, how can we make this work? A lot of the things that we're doing are things the Sheriff's Department in the past has asked for and requested. Things we're bringing online, mobile crisis response teams, more crisis stabilization units, more investment in things, more investment in mental health and behavioral health, but it took us sitting down to figure out how we can get these two separate entities of county government to work collaboratively and work together. And I want to thank Dr. Luke Bergmann and his team. Again, I want to thank Under Sheriff Kelly Martinez, who devoted tremendous time and energy. I want to thank Assistant Deputy Sheriff Erica Frierson for many, many, many months and great commitment and effort to get us to this point. And again, we have a lot of work ahead of us. There's challenges with hiring individuals. There's a shortage of behavioral health workers. There's going to be challenges of integrating all this, challenges of data. But again, we are moving forward, and we all agree a greater investment, a greater commitment, a greater focus on helping people who come into our system get the mental health services they need, the substance use services they need, the connection to services upon discharge, we think can do right by these individuals, but also do right by the taxpayers of San Diego County in lowering our recidivism. And a component of this MOU also focuses on potential cost savings and how any cost savings through lowered recidivism can be reinvested back into providing care for San Diegans. So really significant step forward today for many, 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 many months of work. And with that, I would like to introduce Under Sheriff Kelly Martinez. And again, just want to thank you for bringing a fresh start and being willing to say, look, here's what we need and here's how it can work. And again, all of the hours and hours of work that went in behind the scenes to get us to a place where we're doing right by San Diego County. So thank you, Under Sheriff.
Thank you, Chairman Fletcher. I don't think I could say it any better. He's really encapsulated everything that we've been working for so hard. The Sheriff's Department's absolutely committed to providing the best health care in our jail systems. This is a huge step moving forward in being able to do that. We're so grateful to the board and to Chairman Fletcher for funding this initiative, and really grateful to Behavioral Health Services, and in particular, Dr. Bergmann for his collaboration in this effort. We have been working for a long time this year towards this goal. This MOU is the next step in many steps moving forward to get this accomplished. As the chairman said, we've got about 80% of our individuals in our custody that are addicted to illicit substances. Having and providing them the medically assisted treatment while they're in our care, in our custody, will go a long way to making them healthier when they get released, and providing them services when they're in our communities. And by having healthier individuals in our communities, that'll go a long way to reducing recidivism and towards public safety. I want to thank our healthcare staff that we currently have, and we are hiring, as the chairman said, 160 more healthcare professionals to work in our facilities to help towards these goals. What will happen when people come into our custody is they will be screened at booking, and that screening will, excuse me a second. So to start off with, this collaboration will be effective in intervention, which starts at the door. During the booking process, anyone who enters our jails will systematically be screened for substance use disorders, and that will include their history of alcohol, drugs, or opioid withdrawal. They will be clinically assessed by sheriff's medical staff for participation in the treatment program. And for those individuals who take advantage of the opportunity and are entered into the program, they will be offered addiction medication as prescribed by a doctor. This medical treatment will be coupled with counseling, behavioral therapy, and wraparound services. An important aspect of the program is the continuation of care when they are released, and in partnership with HHSA, the patients will have access to medication and connection to clinics and insurance when they are released. The Sheriff's Department is committed to supporting our communities, and this enhanced health care for individuals when they're in jail will go a long way to providing them with the resources they need. So in summary, we're really, as I said, the Sheriff's Department's committed to improving health care in our system, and we're really grateful for this MOU as the next step in a long-term goal of providing that care. So I'd like to introduce or have Chairman Fletcher come back up. Thank you.
Thank you, Under Sheriff Martinez. I'm going to introduce Dr. Luke Bergmann next. Our efforts around behavioral health really are system-wide. We're doing everything from significant investments in regional hubs, crisis stabilization units, issues around workforce, issues around Medi-Cal and the Cal-AIM process and the structure around the funding, workforce issues, significant issues around substance use issue. We're really trying to holistically take, and even on the preventive side. Our board recently allocated significant funding to do mental health screenings for every child in public schools and bridge those services until it is available for them. But a critical component of all of this is our correctional system. And while, again, the goal is to divert people from having to enter the justice system, that really is the point of mobile crisis response teams, a significant investment. How do we divert folks out of that? For individuals that have to go into this system, if we don't have this investment, then all of the other things we are doing are not going to be nearly as effective as they should. And so we really think what we're doing here today is one of the kind of pillars or anchors of the entire system-wide reform and change we're trying to do. And I want to thank Dr. Bergmann not only for the incredible work on this piece of it, but his incredible work on all of the pieces of everything we're trying to pull together. And so with that, let me introduce Dr. Luke Bergmann.
Oh, shucks. Thank you so much, Chair. Thank you, Under Sheriff. I also want to thank in particular Assistant Sheriff Erica Frierson, who has just been tireless and extremely open-minded and generous in leading this work, and Commander Billy Duke as well, who has shown just tremendous leadership within the Sheriff's Department in leading this. So thank you so much to you and to your really incredible team. Incarceration puts people's health at risk. We know that. And jails, in most cases, across the country because of that, are likely to harm the public health, both physical and behavioral. We know that being in jail usually exacerbates mental illness and makes those who are incarcerated much more at risk of overdose death, for example. The work that we're doing here can help to turn that table so that the jail is best equipped to mitigate the potential damages of incarceration while optimizing every opportunity to connect people who enter jail with ongoing, evidence-based, community-sided care when they leave. This is key to understanding what we're doing here. While we're building up care capacity that will be sited within the jail and delivered by county staff, we are building that capacity so that we have seamless sets of connections between jail care and care in the community. This gives people who have been incarcerated in our jails the best chance at better wellness and recovery, in particular from behavioral health conditions. Our overarching effort in behavioral health services is to shift from a crisis-oriented set of resources to a harmonized, continuous, or chronic care system that keeps people stable, keeps them safe, keeps them from needing the kind of crisis interventions that we tend to associate with behavioral health, and that the jail is an emblematic example of. All of our collaborative work will reflect this principle. How can we design care to reduce the risk of future health crises? This work will start with a focus on medication-assisted treatment for opioid use disorder. We're taking evidence-based approach to the matter, ensuring that we have the best FDA-approved medications available with a focus on buprenorphine or Suboxone, and ensuring that we have modeled the key components of a medication-assisted treatment or MAT program so that we're identifying everyone who is at risk of opioid use disorder, conducting a thorough assessment, beginning treatment with medications and counseling, and then connecting them to ongoing and community-sited care supported through the county's drug Medi-Cal organized delivery system, which includes multiple opioid treatment clinics so that they will stay well. Currently, only 10% of people in the community who have substance use disorder ever get treatment for it. Treatment is often stigmatized, and substance use disorder is an extremely challenging to treat chronic relapsing illness. With an emphasis on risk identification through universal screening of the jail population, where we know that rates of substance misuse are between 65 and 85%, the establishment of an evidence-based MAT program enables us to make some real inroads into this intractable dynamic. One of the gravest indices of the current pandemic has been the incredible spike in drug overdose deaths in our community and across the country. Nearly 1,000 people died in San Diego County of drug overdose in 2020, and we know that risk of overdose is higher for people leaving incarceration than for others. The MAT program will help us to address this crisis as well. But medication-assisted treatment for opioid use disorder is just the beginning of this collaboration. As the collaboration matures, Health and Human Services and the Sheriff's Department will have opportunities to create additional conduits between our jails and ongoing community care, so that at even greater numbers, we are able to turn moments of crisis into opportunities for recovery and wellness. Thank you.
We have an obligation as a county to make the investments that are needed to get the best outcomes. And today's significant step forward represents the framework that will allow this initial $25 million investment in 160 individuals to be integrated into the system of care in our jails in hopes of getting better outcomes. And we will continue to work to monitor the implementation, assess lessons learned, and any adjustments we need to make in the future. But again, I want to thank Under Sheriff Martinez and Dr. Bergmann for the collaboration, and everyone at County Behavioral Health Services and everyone at the Sheriff's Department who have been so committed to getting us here today. And we know we have a lot of work ahead.